In March 2022, a retired engineer in Charlotte and his wife sat down with their financial advisor to review the numbers one final time before signing their retirement paperwork. Their combined savings totaled $1.8 million. By almost every measure, they were ready. Their investment mix was conservative enough to survive a downturn, their withdrawal rate was sustainable, and their mortgage had been paid off years earlier. What their advisor's spreadsheet did not show was a single line for healthcare between now and Medicare. At 62, Medicare was still 3 years away. 3 years does not sound like much compared to a 30-year retirement, but the math told a different story. Their advisor ran a separate calculation, one most retirement plans never include, and the number that came back was $47,000. Here is where it came from. The couple's household income, drawn from investment withdrawals and a small pension, placed them just above the range where ACA subsidies phase out completely. Without meaningful subsidy support, a marketplace plan for two people in their early 60s runs well over $1,500 a month. Multiply that by 36 months, and the total crosses $50,000 before accounting for deductibles or a single doctor's visit. This surprised them more than almost anything else in the entire retirement process, because on paper they looked financially secure. $1.8 million sounds like more than enough to absorb a $50,000 expense. But the number mattered less than the timing. That money was invested, tied up in a portfolio built to last 30 years, not sitting in cash waiting to be spent on premiums. Pulling it out early, especially in a down market year, meant selling assets at a bad time just to cover a bill that had nothing to do with their long-term plan. There was a second complication. Every dollar withdrawn to pay for healthcare counted as taxable income, which pushed their reported earnings even further past the subsidy threshold. The more they withdrew to cover premiums, the smaller their subsidy became, and the smaller their subsidy became, the more they had to withdraw. It was a loop most retirees never see coming until they are already inside it. Their advisor called it a feedback problem, the kind of thing that looks small on a single spreadsheet row but compounds quietly across 3 straight years. Their advisor eventually proposed a fix. Instead of withdrawing a large lump sum, they would draw smaller amounts spread carefully across 3 tax years, keeping their reported income as close to the subsidy threshold as possible without crossing it by even a few $1,000s. It meant tracking every dividend, every capital gain, and every withdrawal down to the dollar, checked monthly rather than once a year like most retirees are used to. A level of attention that felt, in their words, closer to running a small business than enjoying a retirement. It also meant delaying a large home renovation they had planned for their first year of retirement, because a normal cash withdrawal for that project would have pushed their income over the line and eliminated thousands of dollars in subsidy for the entire year. A renovation, something with nothing to do with healthcare, had become a healthcare decision. The same was true of a planned trip to visit their daughter overseas, which they postponed a year simply to avoid an unrelated withdrawal that would have tipped their income over the threshold at the wrong moment. The $47,000 figure was not a worst-case scenario. It was the realistic, expected cost for a healthy couple with no major medical events, using a marketplace plan with an average premium in their region. A single hospital stay, a surgery, or a chronic diagnosis during those 3 years could have pushed the number considerably higher. Since marketplace plans still carry deductibles and out-of-pocket maximums even after a subsidy is applied, sometimes adding several $1,000s more in a single bad year. Their advisor built a separate, more conservative estimate for that scenario, one that assumed at least one serious medical event, and that number came closer to $70,000 across the same 3 years. What makes this couple's situation useful and worth walking through in this much detail is not that it is unusual. It is that it is common and almost entirely avoidable with 3 years of advanced planning. Couples who calculate this number before they retire can build it into their withdrawal strategy from day one, treating the healthcare gap the same way they would treat a mortgage payoff or a college fund, as a known budgeted line item rather than a surprise. Couples who discover it after retiring, the way this couple nearly did, are forced to make reactive decisions under a healthcare deadline they never saw coming, often at exactly the moment they were hoping to stop thinking about money altogether. 3 years, $1.8 million in savings, and still a $47,000 problem nobody had priced in.